This mini-sim trainer is intended specifically to develop the correct skills to perform a tap block and quadratus lumborum block. Like all mini-sims, this model is manufactured using data collected by three-dimensional CT scans of actual human anatomy. The data is then imported into a 3D printer, and the models are made to accurately mimic the anatomy of an average-sized adult man or woman. Like other mini-sims, this mini-sim contains a tray for convenient placement of the anatomical model, which can accept actual injections of fluid, usually sterile water. The remaining fluid will leak onto the tray, which prevents soiling the surrounding work surface. The user can then safely practice injection techniques with the mini-sim. Mini-sim trainers feature extremely realistic anatomical landmarks. In fact, we can see the umbilicus here, and we can see the slope of the abdominal tissue and the muscles. We even see the shape of the rectus abdominis muscles. Furthermore, the tactile consistency of the tissue accurately mimics the skin and tissue of a real human body. To perform the transversus abdominis plane procedure, we typically use a linear probe. This is going to be medial orientation, and this will be our lateral orientation. For the depth, we will set the machine to 4 centimeters. As we place the transducer on the abdominal wall and slide it slightly laterally, we recognize 3 specific tissue layers: the external oblique, internal oblique, and the transversus abdominis muscles. In fact, slight tilting of the transducer helps visualize the fascial sheaths that are involved. We usually use 2 hands to tilt the transducer in order to exercise a greater degree of control. Once we localize these fascial sheaths, the needle can be inserted in plane, out of plane, or any other way the user needs to practice needle placement for the transversus abdominis block. In this particular example, we will use an in-plane needle placement, going medial to lateral. Here's the needle passing through the external abdominis and internal abdominis muscles. We can quickly see that the needle needs to be placed a little steeper to pass into the plane between the internal oblique and the transversus abdominis muscle. An injection in this plane results in a wide, linear dispersion of the injectate between the internal oblique and transversus abdominis muscles. In actual patients, we would typically want to perform the tap block in the mid-axillary plane. The needle is inserted from lateral to medial, like so. The needle is now placed in the external oblique muscle, passing the fascia between the external oblique and the internal oblique. We will need to change the needle angle slightly, and there it is. The needle enters the fascia between the internal oblique and the transversus abdominis muscle. And again, we can practice an injection of the injectate to determine the proper spread. In this particular situation, we're a little too deep, so we will pass the needle more superficially. And here is the proper tissue plane, and now we can see the dispersion of the local anesthetic in the correct plane. Let's do this one more time, with the needle placement from the lateral to the medial. And now we're in the proper plane, and the injection of the local anesthetic then spreads within the desired plane. This can also be practiced with the insertion of the needle in an out-of-plane position. We can see the 3 muscles, and our placement starts with observing the needle insertion. There's the needle tip, and then we continue advancing the needle very slightly while sliding the transducer in order to guide the needle tip to the desired tissue plane. In this case, between the transversus abdominis and the internal oblique. Injection here results in a spread of the local anesthetic in the proper plane. So those are two different ways we can use to exercise the advancement of the needle and practice injections for the transversus abdominis plane block.